right, you're watching TVC. Now, the point there is you have been watching this morning with my colleague Yuri Folarin all the while, but we'll break into that show to bring you updates on the reporting that we have been covering, the first case of the coronavirus in Nigeria. A lot of people have been talking about it, but moments ago, the governor of Lagos State, Governor Babajide Sanwo-Olu, alongside the Commissioner for Health, Professor Akin Abayomi, addressed the press, and they were trying to give assurance to Nigerians and giving updates as to what is going on. Also, alongside that, the Minister of Health, Dr. Osagi Ehanire, also was conducting a press briefing where he was also alongside with officials of World Health Organization. We're talking to Nigerians as to the level of preparedness. Right here in the studio right now, I have the Deputy Governor of Lagos State, Dr. Obafemi Hamzat, also to talk about this so that Nigerians can really understand the level of preparedness when government tells you they're preparing. It's good to have you join us right now in studio.
Thank you for having me. Thank you.
Now, let me start with the issue of preparedness. Before now, the Minister of Health, governors, and in fact the governments in Nigeria have told Nigerians that we are preparing, we are ready just in case. Now we have this right now. Talk to us about the capacity to handle this first case that we have had and the level of preparedness.
Oh, so thank you very much. Before now, we have a biosecurity lab in Yaba. So Yaba is our infectious diseases center. So the essence is we isolated it from the normal general hospitals. So the biosecurity center in Lagos has 100-bed dedicated to this virus in case it happens. So the gentleman that's now diagnosed to have the virus is in that hospital and is getting treatment. So this is what happens. So you have a diagnostic equipment that allows us to detect this early. Remember, it came into Lagos yesterday morning, and by afternoon all the tests has been done. Then we certify that, okay, it is actually positive. So it's been isolated, it's been treated. So what that means is we have the PEP suits, we have the mask for all the, so the essence is we were ready before now. We have all the equipment to do the test and everything so that if anybody develops it, the biggest challenge for us is not to be able to get hands on people that probably have it. So we are lucky in this case, the gentleman came in through the airport. It was taken to somewhere in Ogun State, and then when they call us, we actually brought him back to Lagos in that center.
Talk to us about the issue of contact tracing. He was on the flight with some Nigerians, yeah, and since then he also had contact with some people. Talk to us about the effort towards tracing the contact of the persons he.
So that's the process that has started now. Right. So you know, on the airline, everybody fills a form. So what we are now doing is to go back to those forms. Hopefully the information are correct. So we are contacting everybody. And then even the driver that took him from the airport to where he went and in that company. So those in the company, we've been able to identify them. We have identified the driver, so they will be tested, quarantined. So the airline, we are going on that now. Hopefully we'll be able to get everybody to check them. Hopefully, a lot of them have not gone to other country or whatever. So, but the reality is that we are tracking all those people now so that at least we can check their status to make sure that this thing has not spread to any other person.
All right. Lagos State is one state that is investing so much in tourism. And if there is any panic as to people's safety on one hand and maybe an epidemic on the other hand, it is going to affect and impact the way people react to all of that.
Absolutely.
What impact will this have on the tourism effort in Lagos?
So what we are telling everybody is, like the governor just said, we should not panic. So the reality is that people do have flu. Flu actually also kills people. Okay, so coronavirus is there, but we are lucky that the fatality rate for coronavirus is 2%. At least that's what the organization has told us. Some others are 35%. So we are lucky. So what that means is that the moment people are identified to have it and they bring them into the isolation center, they can be treated and they'll be fine. So what is important is the readiness of that infrastructure. Lagos is ready. We have everything that it takes. We have the facility in place, we have the PEP suits, we have the mask, we have the doctors in place. So as long as we are able to track people and bring them in, there should be no panic. everything. People will be isolated, they'll be treated. When they are well, we take them back to where they come from.
All right. We have various agencies. The Lagos State government has its own strategy trying to ensure they handle this. The Federal Ministry of Health is there. The National Center for Disease Control is also there. How are you? Talk to us about the coordination between...
No, there is major coordination.
Okay.
About a week or so ago, you will notice that the Minister for Health was in Lagos. He went to that biosecurity center to check that is it aligned with the protocols of federal government. So, and in fairness, he said, oh, we are clearly the most ready. Clearly they are most ready. There are some advice that we should raise some fence so that people cannot jump in or so, which is already done. So in terms of coordination, we are working with the federal government, or the Center for Disease Control, and Lagos State government. As a matter of fact, if you go to the airport today, 24 of those staffs checking people at the airport are Lagos State officials. So in partnership with the Federal Ministry of Health. So we are working together because this is to protect our state and is to protect our country.
All right. If you go on social media, there's a lot of reaction already. What enlightenment processes is the government trying to deliberately put on ground to ensure that people don't panic?
Well, so that will continue now, but part of it is this, to tell people the governor has done a press conference, but over the next few days, people will see that they will give everybody status update without mentioning the gentleman's name, that it's okay. If we've detected another person in the process, we will announce it. So what is important for us is to be transparent, tell people the real situation, and then give guidelines as to what people need to do. And it's what our parents have been telling us since. When you want to cough, cover your mouth, or sneeze into your elbow, or go around with handkerchiefs, clean your hand, wash your hand. It's as simple. And if people cough persistently beside you, make sure you maintain a 1.2 meter distance, clearly. So just like the distance between you and me now. So if people are coughing, that's it. The moment you're able to do that, let us go about our businesses. There is no need to panic at all.
All right. Before I let you go, let me narrow down back to the isolation center that you talked about, the infectious disease center. Now, talk to us about the capacity that you mentioned earlier on, and just in case, we're not envisaging anything more, but in case the capacity of the hospital is exceeded, what happens?
So we have it's a 100-bed,
okay,
but we are also now building outside tents that can be covered in, but what is ready now is the 100. So we can extend the capacity maybe to 200. But in case of epidemic, in case of the number, we don't pray that, but we must be ready. So we've identified 4 other hospitals. We are a general hospital that has the space where we can actually isolate people, 4 others that can have minimum 50, 50, 50, so that at least we can ramp up to 400 at a single time. We hope that's not going to be the case, but we are ready in case that happens.
All right. Thank you very much, Dr. Obafemi Hamzat, Deputy Governor, Lagos State, for talking to us right now.
Thank you very much.
All right.